That's when I hit rock bottom. It wasn't when I was diagnosed with cancer. It was when I was told that I no longer had cancer. And at that point, it was really about going to figure out what the next step was. And that's when, all these changes started to occur for the better.
Welcome to the Therapy Show podcast. I'm your host, Lisa Mustard. In each episode, I interview a seasoned and knowledgeable talk therapist from the counseling world to glean valuable insights, techniques, and tools that you can apply to your practice and your life. And if you're considering a career in the counseling field or just want to hear about what it's like to be a talk therapist, then this is the podcast for you. Hi friends, before we dive into this episode, I wanted to share some exciting news with you all. I recently obtained my National Board for Certified Counselors approved continuing education provider credential, and that means that my pod courses are now approved for continuing education contact hours, and I'm giving you your first one for free. Just head to my site, lisamustard.com, enter your email address, and you'll get a code for a complimentary continuing education contact hour. So far, there are 4 to choose from, yet more are on their way. I've made it my mission to provide you with continuing education that fits your busy lifestyle. No more having to sit in front of a computer to obtain your contact hours if you don't want to. You can listen to the pod courses in between sessions, on your commute, while you walk your dog, make dinner, fold laundry, whatever it is that you're doing. And to receive a certificate of completion, you need to complete the self-study survey and the evaluation. And don't forget, your first one is free. So head to my site, lisamustard.com/pod courses to check them all out. Okay, let's talk about this week's guest. This episode is from Doctor to Patient with Dr. Diva Nagula. He is a board-certified osteopathic physician with extensive knowledge and training in integrative and functional medicine. A Washington, D.C. native, he grew up in Alexandria, Virginia, and his interest in medicine developed at an early age when he decided to follow his father's footsteps and practice medicine. Upon completion of his fellowship, he opened a practice in rural South Georgia. His practice grew in both size and prestige in a very short amount of time. Dr. Nagula opened the first AAAHC certified ambulatory surgical center in Georgia, where he performed cutting-edge interventional procedures. He oversaw all aspects of his practice while still managing to see a full caseload of patients. He soon expanded into North Florida with a second practice. Most recently, he has completed training under the renowned Dr. Andrew Weil in Integrative Medicine through the University of Arizona. And in this episode, Diva is going to share his story of fighting cancer and the shifts he made in his lifestyle, including body, mind, and spirit. He owes his successful battle and remission to the tenets of integrative and functional medicine, and he is in the best shape and health of his life. And he owes it all to positive lifestyle changes. And we hope you enjoy this interview. Welcome back to another episode. I am your host, Lisa Mustard, and I'm so excited to have my friend on the show today. His name is Dr. Diva Nagula, and welcome to the show, Diva. It's great to have you.
Thanks for having me, Lisa. Good to see you again.
Yeah, so the shoe is on the other foot, and I am interviewing you this time. If you guys didn't catch my interview with Diva, I was on his show From Doctor to Patient a few weeks back. So I want you guys to go and catch that for sure. I'll link it in the comments because we had a great talk. But tell us who you are and what you do. You have a unique story.
Oh gosh, I don't even know where to start. So I am a physician. In my previous life, I used to practice interventional pain management and was deep into the traditional Western world of medicine. And so I went through schooling, residency, and fellowship, and ended up doing a pain fellowship in interventional pain management. And 6 months after I fellowship, after I was working in my first job, I didn't have a really good relationship with my employer. And as a result, we had an issue where it just didn't work out and we parted ways. It was not amicable at all. And I vowed that I was going to outdo him. And I started my own medical practice. In medical school, they don't teach you anything about business. They don't teach you, and I never took any business courses. And I decided to start my own practice. I had no idea what I was doing, and I just kind of fell into it. And it grew into a monster. It really started to take off because so many people were getting so much better. And it was really a word of mouth kind of operation where people who would tell their family and friends. And next thing I know, it was just growing by the seams. And I ended up having over the course of 7.5 years, 2 offices in 2 different states, one in South Georgia, one in North Florida. And I also had a surgery center where we did invasive procedures to help people who were suffering from chronic back pain, acute back pain. And it just got to be a point where I was experiencing burnout and the stress of running a business by yourself and also seeing patients by yourself. And then managing 25 to 30 people on top of that was just craziness. I did everything from the payroll, human resources, the marketing, accounting, just name it. I was pretty much running all of it. And then, of course, I was also seeing patients. So it was just a never ending process where it was constantly a 24/7 thing. And I never was able to develop any proper coping strategies for the amount of stress that I was under. And needless to say, my health suffered. I wasn't sleeping well. I didn't take care of myself. I didn't really do any exercise. It was just constantly being in a state of fight or flight all the time. And this was consistent with my life. I mean, ever since I was kind of born into this world, I was born into fight or flight. And I never really understood that. And as a result, I feel that is what kind of led to my issues with my personal health crises. I ended up exiting my practice in 2012, and it was really due to burnout. That was really the issue that pretty much sparked the whole thing of leaving my practice. Even though it was successful and it was great, people were having great results, I couldn't sustain it anymore. A year later, unfortunately, what happened to me was I was feeling great, but then I had some issues where I was seeing these, not really growths, but these lumps that were on the side of my neck. And it was these lumps where I was like, what are these? And they were like growing, and they were bilateral on both sides of my neck. And I went to the primary care doctor's office and I said, hey, what is this? And it was normal. It was a routine physical that I was having. And he's like, let's take a look. I don't know what's going on. Your blood work seems fine. You seem to have great energy. You're not like, you don't look sick. You don't appear sick. So, let's just do some more blood work and let's get some x-rays and CAT scans of your neck and see what's going on. So he got a CAT scan, and it actually was of my head and neck. And it kind of lit up in the sense that there were large lymph nodes all up and down my neck and into my armpit area. Typically, lymph nodes are about 1 to 2 millimeters in size. And these were about, 1 centimeter to 2 centimeters in size. So they were pretty darn enlarged. And I was we were talking after we got back the results, and he was saying to me, we don't know what this is. I would feel better if I referred you to an oncologist. And at that point I was like, an oncologist? Why? And I became suddenly the patient. And it was at that point where I was really concerned about what was going on. And he says, well, as you know, enlarged lymph nodes can be a result of something that's going on infectious, something that's going on, it's inflammatory. And of course, it could be something that's cancerous. We have to rule those possibilities out. And at that point, again, I was more concerned when he was talking about the possibility of cancer. And I went ahead and agreed to getting the referral done. I went to the oncologist, and after a lot of workup that included a lymph node biopsy, a bone marrow biopsy, a battery of tests, a battery of CAT scans and other scans of my body, my wife at the time and I went to the oncologist's office after everything was done, and he gave me the report that I had stage 4 non-Hodgkin's lymphoma. And it didn't even register to me. I was just really shocked at that point. He was telling me that it was important for me to start chemotherapy immediately. And at the time I was 40 years old. Again, I had just gotten married. I had just exited my medical practice. I was ready to, turn the page over and start a new chapter in my life. And I was, really ready to start a family in the whole 9 yards. So this was just a blow to all my plans, all of my hopes and dreams that I had envisioned for myself for over many, many years. At that time, I told the doctor that I needed to just take a minute and kind of do some introspection and kind of figure out what I wanted to do. And I wanted to research this on my own. And as a physician, you would think that I would already know the answers, but I wasn't trained in the field of oncology. I was a pain management physician, so this was a little over my head and out of my realm of expertise. I saw multiple specialists, and I went to Sloan Kettering in New York, which is a very well-known cancer hospital. I also saw a person at Mayo Clinic in Jacksonville, and they were both more specialists in lymphoma. The guy that I saw was a private practitioner, and he was more of a general oncologist than anything else. And both of these practitioners that I saw for second opinions did not feel that I needed to start chemotherapy right away. So it kind of told me that what this guy was telling me, this private practitioner, was it could have been right if the situation was accurate, if I was showing more signs of cancer, and if I indeed have like blood work that was consistent with a failing system, but it wasn't. So another alternative that was presented to me was called watch and wait. And watch and wait essentially means that you just kind of watch over a period of time to see if you can enable risk stratification strategies to reduce the cancer possibly, or to see if it got worse. And so at that point, I was really motivated, and I wanted to do a lot more research, and I wanted to do anything possible where I could help regress the cancer. And after about 6 months, I mean, I literally changed my diet. I no longer had the stress that I used to have because I wasn't working at the time. So it was really literally dedicating myself to wellness. And I slept better, ate better. I restarted some meditation practices, and I thought I was doing really well. And then towards the end of that year, I started to have this really bad back pain. And it was interesting. I was like, okay, well, I know back pain because that's what I did for a living, but this pain was radiating from my low back into my groin area. And I was like, could be a kidney stone. And kidney stones are common with folks who are having cancer because of the high cell turnover. And so that's what I thought it was. So the oncologist says, well, you're due for a scan in a couple of weeks. Let's bump it up and let's see where you are. And I got the scans done, went back to the oncologist. And at that point, he said that, well, we need to start chemo ASAP. The cancer had grown. All the tumors that were initially enlarged to like 1 to 2 centimeters from 1 to 2 millimeters, it got to the point where you couldn't even recognize the lymph nodes anymore. It coalesced. All these lymph nodes coalesced into masses. They were all over my body, all over my low back and in my abdomen area. And the lymph nodes in other parts of my body were just extremely enlarged. So at that point, it was really about going to chemotherapy and surrendering. And that's where the issues started to arise, because at that point, I felt I had no longer any control over my life, and I didn't know what to expect. I had lost all issues of reality because everything that I had dreamed about, everything that I had worked so hard for, just was about to go up in smoke. And I realized at that time, looking back, I could see that I had a huge issue with control. Like I had to have control over every aspect of my life and what I did. And surrendering to this process was so difficult for me. It actually put me into this deep, dark depression and anger. And unfortunately, that was not good for me. I shut everybody out of my life, including friends, family, and my wife at the time. And we weren't getting along very well. And it ultimately led to her leaving during the process of my treatment, and we ended up having a divorce. And so I was really alone going through chemotherapy and going through treatment. So it was probably the worst. I mean, going through chemo and cancer treatment you would think would be the hardest part of this whole ordeal. But fortunately for me, fortunately or unfortunately, depending on how you look at this, is that after about 5 months, I ended up going into remission. And I was relieved that obviously the cancer was no longer a part of me. However, I was struck with this whole new reality that I didn't have anything else to look forward to. You know, you're looking for 6 months to get out of cancer, and then all of a sudden, my identities once again disappeared. I was a physician. I was practicing medicine. That was gone since I exited my practice. I was also a husband, and I was hoping to be a father. That was gone. And then I was struck with cancer. So I was fighting cancer. So that was my new identity, and that was gone. So it was, as I stated in my book, that's when I hit rock bottom. It wasn't when I was diagnosed with cancer. It was when I was told that I no longer had cancer. And at that point, it was really about going to figure out what the next step was. And that's when, all these changes started to occur for the better.
Wow, Diva. Thank you, for sharing all of that. Hey friend, want to be more comfortable while sitting on the therapy couch? I sure did, and went looking for pants and tops that were soft, wrinkle resistant, and would match just about anything I already had in my closet. And now Zaya Active makes up about 80% of my wardrobe. Would you like to learn more? Head over to my site, lisamustard.com, and click on the Activewear tab. And don't think this is just for women. They have men's and kids' clothes too, and our family is loving the quality, and I am loving the price tags. So head over to my site to check it all out. I didn't know any of that had happened. I mean, I knew a little bit of your story, and just so you guys know, Diva and I went to undergrad together. So we go way back. We go back like 25 years. So we're both the same age. You're 47, right? We're both 47. Mm-hmm. Yeah. I grew up in Virginia. Did you grow up in Virginia too?
Right. Yeah. Yep, right outside DC.
Yeah. Okay. So Diva and I haven't seen each other in 25 years, and we just reconnected, and it's fascinating to me. So much just happens, so much happens, and I'm just blown away. I need to read your book for sure, but I wanted to kind of dig a little bit deeper, if it's okay with you, and talk about the identity crisis that you had, because it happens in midlife for sure, but it also sounds like it wasn't just a midlife thing for you. It was, well, who am I if I don't have these labels on me? What did you do specifically to work through that?
Right. So again, the biggest thing for me was that I was alone, and that I really needed to, at that time, I didn't know it, but I really needed bonds of people. I needed to reconnect with folks. And as I outlined in my book, the one thing that kind of sparked and changed and helped me towards my transformation was running into my personal trainer in a parking lot of a grocery store. And I ran into him, and we're buddies, we're friends, and he and I had a really great relationship. And I enjoyed working out with him. And he's like, how are you? I told him that I was in a remission. He's like, well, are you able to start working out again? And I said, yeah, I am. I just didn't have the motivation to do it because I was so fatigued from the cancer treatment that I just, at that time, I took a couple of months for me to regain some strength. And he's like, let's do it. So we went ahead and started working out, and it was really the exercise and also the camaraderie that we had that was re-sparked, and that really, I think that was the impetus of just starting the transformation process for me. I started feeling better after working out, sweating, getting those endorphins up. And then also that bond that was created with my personal trainer. It was great that I needed, that relationship and that friendship that we had just to share things, to communicate things that I hadn't communicated with people. And he was a really good listener. And then you stack that with just some vigorous exercise. And then I started to see some transformations with my body. I started to have loss of all this fat and increase in muscle. And I started to look better in my clothes. I started to feel better. I started to have, and that triggered a positive outlook for myself. So that depression, it was still there, but it was definitely mitigated by these activities that I was engaged in.
Yeah, that's really great to hear. I mean, it started with running into a friend, somebody that you trusted, that could help you, that cared about you, good listener. That's really important. So what else did you change up? It sounds like you changed up your nutrition.
Yeah, well, at that point, it was, I thought everything that I had done previously failed because I had totally changed my diet. I went from eating a diet that was full of processed food, full of going to fast food restaurants. I didn't care what I ate. And as you would think as a physician, you would know better, but they don't teach you nutrition in medical school. And it's such a travesty because that's so important in shaping our health. And for me, that was a big wake-up call. I also felt that whatever I was doing before cancer, even though it was the right stuff, during that process, I thought it was a failure, but it really wasn't. I think if I didn't engage in those activities, in terms of sleeping better, in terms of eating better, I probably would have had to start chemotherapy much sooner than later. After, everything was said and done, I restarted the exercise. I restarted the diet. The biggest thing for me was that I really wanted to stay in remission. I didn't want to have a relapse. So that was my motivating factor. So for me, it was a physical part about it. I wanted to really engross myself into activities that optimize my physical well-being. And that was obviously exercise, elimination of processed foods, elimination of sugars, and just really eating a good, healthy diet. And the biggest thing is that when I was doing my research was that cancer feeds off of sugar.
Mm.
And so I had to eliminate anything that was simple sugars and anything that was really high in glycemic load. And those were the things that was hard for me. And because I was so used to eating things, whatever I wanted, processed food and things that had sugars that would spike my insulin levels and obviously would spike my sugar levels as well. So that was one thing that I really was forceful in adhering to. And then switching over to an organic diet because that's got has more nutrients content. And the biggest thing for me was that I had to eliminate the pesticides and herbicides that's often seen in foods that aren't organic.
Mm-hmm.
And as I later found out, it was these pesticides, specifically glyphosate, which is the active ingredient in Roundup, that had a causal link to non-Hodgkin's lymphoma. And at that point, you were starting to see some of these issues with the product Roundup, where the WHO had actually stated that that particular glyphosate ingredient is a carcinogen. And then we started seeing all these cases, legal cases, start with lawsuits against, at the time, Monsanto, now Bayer, because of the direct link between glyphosate and cancer.
Yeah.
So those are the things that I initially I was very adamant about sticking to. And then unfortunately, not unfortunately, but I did master that, but I neglected other things that I needed to help heal. And, as in my book is called From Doctor to Patient, Healing Cancer Through Mind, Body, and Spirit. I had conquered the body part, but I didn't address the mind and the spirit.
Yeah, I was going to ask you about that next. I was curious to know what things did you implement to help you move in those directions of healing?
Right. So a lot of the things that I started to research and understand, I actually had to move. I moved away from Florida and I moved back up to the DC area where I could be closer to family and friends. And I thought that would really be the spark for me to help get me out of my funk that I was in.
Mm-hmm.
Granted, I felt it remarkably better, but there was still this deep, dark depression, anger, sadness that I had. I never really coped. I never really cried. I never really just dealt with everything. It just kind of got buried. And it's unfortunate because I really feel now that if anyone has a process where they have cancer or have a loved one that's going through cancer, you really need to see someone for this. You have to have some sort of counseling to help not only yourself, but your family members as well. That was not addressed to me. And I think it was a failure of the oncologist seeing me as a physician and probably thinking that I would know better and do this on my own. But I've always said to anyone through my podcast and through my book, that's the first thing that you really need to do is, seek some counseling.
Mm-hmm.
I feel that if I had, I would have probably saved my marriage. It would have probably gotten me out of the funk that I was in, and it would have enabled me to process all these emotions that I had kind of like buried in me.
Yeah.
So I really needed to move forward and deal with that. So I engaged in a lot of mindfulness exercises. And for me, unfortunately, as a physician, we do not have the ability to live in the moment. And that really is a fundamental thing that I think all people should really try to strive for, is to live in the moment and not worry about the future, not worry about the past, and really live, in the moment and as best possible. And that's what mindfulness is. It's really living moment to moment without any judgment. And for me, it was very hard because as a physician, and when we're in medical school, it's always about the next step. It's always about the next board exam. It's always about, we have board exams, all the time. Then we have to apply for residency. Then we have to go through residency and then take another exam. And then we have to go finally find a job. So we lose our entire decade to this process.
Yeah.
And it just starts to get ingrained, and it's a new process that you go through. And that process of living for the future and having regrets of the past was something that, it was my new reality. That was contributing to me being in consistent fight or flight. And as we know, being in a sympathetic state or fight or flight is horrible for our bodies. And, the undue stress, can cause so many different chronic conditions in our body, anywhere from having issues with a leaky gut, which can cause issues with the leaky brain, can have decline in cognitive function, decline in overall physical well-being. Even though I felt great, there was so much stuff going on in my body that I had no idea how bad my body was. And so that was the thing for me, is that I really needed to engage in some mindfulness practices to really calm myself down and get more into a parasympathetic state versus a sympathetic state.
Yeah. Well, I'm glad that you were able to work on those things. Are you tired of trying every fad diet out there? Are you sick of spending hours at the gym with little to no results? Because that was me, y'all. I want you to consider trying the Faster Way to Fat Loss, the online program that will empower you to transform your life through effective cutting-edge fitness and nutrition strategies with no supplements, none at all, or gym memberships required. So how is the Faster Way different? Well, the Faster Way to Fat Loss isn't a weight loss program, although most of the clients do lose weight. And you guys, I am a client and I am loving this program. Instead, it's a guided program run by one of the certified coaches. My coach, her name is Teresa, and she is awesome. The online program is designed to teach you how to live a healthy lifestyle so you can burn fat, improve your health, and feel incredible every single day. You'll have the energy to play with your kids, go on those someday adventures. You guys, we just had one a few weeks ago, and keep up with your busy day-to-day life. You'll do all of this with the whole food nutrition cycle, which they cover and explain all of. Easy to follow meal plans. And you guys, they are super, super easy and simple. I don't love to cook, but these meal plans make it really easy. And workouts for every level of fitness. There is a gym workout, a home workout, and low impact workout. So if you're brand new or intermediate or advanced, there's something for everybody. They use science-backed cutting-edge strategies that really, really work. So if you guys want to learn more about the Faster Way to Fat Loss, head to my website, which is www.fasterwaycoach.com/#Lisa Mustard. I'll put that in the show notes so you guys can just make it super easy and click on it. I hope you come and join us. I was going to comment earlier when you were sharing your feelings about your diagnoses and the labels that you had to give up. It sounded a lot like a grief process to me. You were grieving the loss of these labels of who you are or who you were. And for a lot of people, that can lead to, symptoms of, all kinds of things. So I'm so glad that you are doing much better these days. You definitely look much better. Just your affect, you're smiling, you have you're glowing from where I sit over watching the video. So you definitely look like you are practicing all of these things. So I wanted to ask you, what are you doing nowadays? Like, what does a day for Dr. Diva look like? Since you're not practicing medicine like you were before and you're staying more in the moment, how did that kind of all come together for you? And what does your life look like now?
Well, a year ago, I got maybe a year and a half ago, I got sort of like some insights that I really needed to share my story with people, specifically with folks who are suffering from cancer or have loved ones with cancer. And I decided to write my book, and I wrote my story. And again, it's really about my life pre-cancer, going through cancer, and then post-cancer. And it talks about, it's like a biography that's intertwined with a lot of medical facts and tips for people. It really is, I feel, it's a good handbook, or what I call it is a good buddy for people, because a lot of people who are struck with cancer, the first thing that they do is that they lose all hope. They lose a sense of reality. They just kind of give up. And especially a person who isn't in the medical field, you are just absolutely clueless. And it's almost to a point where you're inundated with all this information from your oncologist, and it is very daunting to go into a situation where there's so much information to read, to absorb, to assimilate, where it's almost impossible because you don't have the medical background, and you're trusting your physician to decipher all this information for you, and you don't know what other options exist, and you just basically are listening to professionals. And a lot of times these professionals, they don't give you the best information. And so I felt that it was necessary to put some basic information into a book. And me as a person writing this from a perspective of a patient and as a narrative from a physician, I felt it was a right combination to put onto paper for people to read.
Awesome. And so this book has hit some bestseller lists, I'm aware. Is that right?
Yeah, it made it, I think it was number one in multiple categories on Amazon. And when it was released last year before Christmas, it became number 3 on the Wall Street Journal bestseller list.
That's exciting. Congratulations.
Thank you.
It's really cool. Do you have another book in the works, or you thinking?
Not yet. I mean, some people are telling me that I need to start looking to do so. And, it's been a year since I published this one, but I feel that over the next, few years, I'll have some, some more insights and some information to share. Definitely.
Yeah.
And that was a whole other thing that I also started was this podcast.
Yeah.
And my podcast was sort of a continuation of my book. And the intent of the podcast was to really showcase various healers and healing modalities that are somewhat off the beaten path, but have science backing it.
Mm-hmm. Oh, that's cool. Yes. I love your podcast. I've learned so much as I've listened to the episodes. They're great. They're really, really good. So where can we find your book? I'm guessing all the places that you can normally find books.
Yeah, you can go on Amazon and purchase it, or Barnes and Noble and Books A Million. It's definitely findable through those. Yeah.
Is there anything else that you have going on that if people want to connect with you and learn more?
I'm engaged in a current program, and I'm learning about genetics-based medicine. And I feel that genetics-based medicine is going to be the wave of the future. Essentially, we're born with a set of genes, and unfortunately or fortunately, we have advantages that are given to us through our genes. And at the same point, we are born with disadvantages that predispose us to chronic conditions. And so it's understanding those genetic traits and personalizing a plan of action for each individual. So I don't feel that people it's a one shoe fits all type of scenario. It's something that medicine needs to be personalized. Yeah. And, I can't, somebody else who is receiving a specific kind of care compared to me, it might not be the appropriate care for me because my genes are different and my genes might predispose me to a different outcome. So that's what I'm learning now. And that, along with my integrative medicine training, where I learned a lot about alternative therapies and other modalities, are helping me shape how I can treat people in the future.
Yeah, that's really neat. I wonder what that's going to be like, what that's going to look like for you. Are you thinking you might start another practice? You think that might be for you, or you don't want to go there?
I don't know yet. I mean, I feel like I've done my work in terms of helping people on a one-on-one basis. And don't get me wrong. Yeah. I mean, it's very gratifying,
sure,
but I really want to help the masses. And so that's my goal, is to learn the best I can and then really try to educate the masses and try to help them transform, because if you really want to make a change, it can be done on a one-on-one basis, but it's going to take forever. And so that's why I have the book. That's why I have the podcast. These are 2 avenues where I can reach the masses.
Yeah. Well, I'm so glad that you are doing the work that you're doing, because you're impacting so many more people this way. That's partly why I started my show too, is, the one-on-one, while it's great and it's wonderful, there's not enough time in the day or in our lives to connect with and help and support and serve as many people as we would like to. So, and then like you said, there's the burnout factor that comes into play. And so I think it's really interesting how you've kept your love and your passion, but you've just pivoted and now doing it on a broader scale. So thank you so much for being here. This is just great. Thanks, Diva.
Thanks for having me, Lisa.
Well, that wraps up another episode of The Therapy Show with Lisa Mustard. I know there are hundreds of thousands of podcasts out there, and I'm thankful you've chosen to listen to mine.
Be sure to visit lisamustard.com to access the show notes and discover more fantastic content.
And I'd be grateful if you subscribe to the show. Thank you.